This video presents Minced Meniscus, Biologic Augmented Meniscal Implant Treatment. An arthroscopic view from the anterolateral portal was performed for diagnostic evaluation of the post-meniscectomy defect. The segmental defect of the medial meniscus was freshened with a shaver up to the capsule. During the process, autologous meniscal fragments were harvested from the posterior and the anterior meniscus, as well as the meniscus tissue up to the capsule using a 4 mm bone cutter shaver blade. The meniscal defects were measured using an arthroscopic ruler to determine the size of the implant, and polyurethane-based medial meniscus implants oversized by 10% was prepared for optimal fitting. The graft nest system were used to store the collected meniscus fragments. The filter chamber and the meniscal fragments were then removed for the opening the tissue collector. With 1 milliliter of ACP, these fragments were created in specialized injectors. Subsequently, ACP double syringe was used to preparation of PRP and the associated concentrated graft factors. ACP double syringe and the thrombinator system were designed to obtain the autologous thrombin solution at the point of the treatment for this surgery. 3 ml of ACP was injected into the thrombinator system before the autologous thrombin solution was made. The system was then agitated for 5 minutes, laid flat, and left for 10 to 15 minutes. Subsequently, the system was shaken to remove the clot. Additionally, 5 seconds of shaking was followed by the reinjection of 6 ml of ACP. Once more, the system was set flat and shaken to dislodge the clot after waiting for 1 minute. The apparatus was turning on its side, autologous thrombin solution was removed through the ports filter, and the thrombin solution was made ready for usage. Both tips of the implant were marked to determine its surface and direction within the joint. To prevent the prepared meniscus implant from disintegrating, a groove was formed in the meniscus perimeter, and the implant body was separated apart in shape of the slit. This slit was filled with the minced meniscus pieces that were repaired with the thrombin. Later, 2 pieces of the 2 sutures were used to close the fissure. Using the carrier sutures, the meniscus implant was inserted in the joint and set at the location of deficiency. The implant was fixed using all inside and inside out sutures.